we all know this. I would guess this is in more conversations at all of your organizations within health plans than I can even imagine. But the persistent over the last, call it 15 years at this point, the persistent trend is we're trying to drive engagement, but there is noise and confusion that for one reason or another is creating a chasm between members and what those members have to access to live at a highest state of health. And so this is a recent 2023 study out of J.D. Power looking specifically at a commercial population and line of business. But I think the extrapolation is pretty easy to sort of extend across membership. Satisfaction is declining. And we're going to see the yield on that in another slide here. But we also see that sicker patients are less likely to proactively receive their care or have that care coordination in place. We know that from an NPS standpoint, and if we're looking at that as kind of a proxy of our ability to retain or potentially lose to attrition some of our members, that NPS is low on a scale of negative 100 to positive 100. The best we're doing is 25. But with new members, we're actually as low as 6. And so we'll come back to those new members and what correspondence can mean to them as one of their sort of inaugural pieces of communication when they're getting started with their plan. Tough numbers, though. And finally, we know that health plans are also investing in huge and very promising digital health tools and technologies. So when we think about chronic condition management, disease management, tools, apps, partners, services, all of those investments are being made, and for good reason. Those are fantastic programs that have the ability to close down gaps of care where patients especially are at their sickest, but the utilization is really low. So again, we have this mountain of opportunity with this almost unknowing or confused audience. And I think our job, and increasingly how Clarity sees its job, is to say we've got an opportunity to sort of smooth out that road between those people and those resources.